U.S. healthcare spending grew 4.6% in 2018, reaching $3.6 trillion, or $11,172 per person. As a share of the gross domestic product, healthcare spending accounted for 17.7%. The services provided by our care delivery professionals is unparalleled, and surveys show that between 7 and 8 in 10 consumers are more than satisfied with the care they receive. However, the complexity of medical technologies, drugs and therapies, supply chains, medical coding, insurance policies, and administrative overhead have created a bureaucratic system full of loopholes. As a result, unwarranted diagnosis for more expensive treatments, inflated billing, upcoding, under-the-table negotiations, cash payments, and a host of other wasteful spending goes unnoticed. A conservative estimate by the National Healthcare Anti-Fraud Association is 3% of total healthcare expenditures are fraudulent, while some law enforcement agencies place the loss as high as 10% of our annual health outlay. That's $300 billion. Only by collecting and analyzing massive datasets across a multitude of delivery points, medical records, transactions, and other key data can this problem be addressed. With Actian Avalanche, you can do just that. As seen here in this healthcare fraud detection and prevention decision support diagram, determining the probability of fraud is a learning process that leverages machine learning, trained and executed on large datasets. Key fraud detection input databases are not only from traditional healthcare records, such as EHRs, but include mental, pharmaceutical, social service, even criminal and tax records. Additionally, edge data from telemedicine and POS transactions may be needed. Data would also be ingested from healthcare-specific and horizontal ERP applications for administrative and operational systems. Bringing this data together in a cloud data warehouse is the most optimal way of supporting modern healthcare fraud detection. In this Avalanche industry demo, we'll use Avalanche Hybrid Cloud Data Warehouse to analyze healthcare data from various systems where the records are in different data formats, a common situation when looking at patient records, billing information, and other data. In this case, we're going to ingest 1 billion records and review the most common procedures and diagnostic codes to look for anomalies that can indicate potentially fraudulent claims by providers. The demo will go on to emphasize that the $300 billion estimate for fraud isn't far-fetched, but instead all too painfully realistic. Now let's take a look at an actual demonstration. As you can see here, we have a Tableau dashboard. We're looking at a dataset representing diagnostic procedures that's been trained and scored. Specifically, the outpatient beneficiary and state where the medical protocol was executed. In aggregate, we have 1 billion records in our database, and for 2/3 of the diagnostic procedures analyzed, scored as 0 likelihood of fraud. However, 1/3 had a score indicating the potential for fraud, and therefore triggering analysts to examine and possibly investigate each of these transactions. By clicking on the high-level summary tab, we see that each diagnostic code has identifiers for male and female. This is useful if one considers many medical procedures, for example, prostate, uterus, and other organs, and related medical care are gender-specific. If we consider the 1/3 of cases where there is some probability of fraud per month, as shown in the bar chart here, the cost of fraud per month in January alone is $9 billion. Of course, different views of the data over and above just gender would be needed to determine if actual fraud occurred. To this end, the billing records are sent to the Avalanche Cloud Data Warehouse in complex queries consisting of joining and interjoining 4 tables across 7 different dependencies are analyzed and published. Now let's take a look at the next tab in the dashboard. Here we're able to see a list of providers associated with potential fraud. If you click on one of these providers, we're able to see that a query submitted to the Avalanche Data Warehouse executes within 6 seconds. the query result is returned and published for this provider's practice, along with the states this provider works in, their claim ID, the attending physician, their clinical diagnosis, and other details for each submission associated with a probability of fraud. This level of detail cannot be published this quickly unless you have a very fast parallel processing database that can join and query billions of records and give you that result back in real time. Let's double-click on and inspect this particular query. As you can see, its parameters match what you just saw in the last dashboard tab, in that it's in standard SQL. We are querying against the specific provider's ID and the claim ID, and then execute inner joins of several tables. Further, there are several dependencies that are returned, including the state where the provider issued the claim, the patient ID, the claim ID, and the diagnostic code for that transaction, as well as the average fraud amount for closed cases of confirmed fraud. In the last tab, we have the cost of fraud by state dashboard to understand fraud probability by state. If you click on a particular state, in this case, we're using California, you find that there are 9,000 unique probable fraudulent claims, and the aggregate cost of these cases is $58 million. Further, there are 167 unique providers perpetrating these potentially fraudulent claims. Note, it makes sense that the most populous state in the US would have the highest number of potentially fraudulent cases, but just quickly looking at this chart tells us that GA on a per capita basis is actually the highest. So as you can see, queries against joined tables representing the details of each provider by state can be very insightful. Let's run the query we were just looking at for the state of Georgia. Within 5 to 6 seconds, it sends the query to the database. It returns the results back with a unique probability of fraud for every claim ID and every provider ID, and is therefore an extremely useful tool for fraud detection. What we've described here is just a starting point to give you some idea of how this could be used. Consider that in many states, the cost of getting a COVID-19 test could range from $100 for one provider, but just up the street, over $6,000 from another provider. A test could be returned in 24 hours or take multiple days to be conveyed back. Far too late for track and trace efficacy. Are these discrepancies just the provider? Are they tied to some demographic but reasonable explanation, such as comorbidity factors? Are they tied to mistakes in medical coding for billing against Medicaid or private insurance? The point is, quickly pinpointing and stopping, or at least requesting justification for these vast discrepancies in processing and billing is critical, not just to reducing fraud, but to ensure optimal and affordable outcomes. In summary, with Actian Avalanche Hybrid Cloud Data Warehouse, you get blazing fast performance out of the box that allows you to easily ingest disparate and diverse sets of healthcare data and perform complex queries that can provide the right insights to rapidly detect the myriad of fraudulent schemes plaguing public and private healthcare insurance providers. For more on Actian Avalanche, or to get started with a live demo or a free trial, visit actian.com/avalanche today.